Welcome to the Birth Squad podcast. If you're riding with the squad,
hey fam!
And if you're new,
welcome to the squad. We're your hosts, Dr. Ijama Okwando and Dr. Kanisha Thomas. We're two licensed obstetrician and gynecologists, as well as best friends.
The Birth Squad is a podcast for birthing individuals by two Black female physicians who use stories from real women to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope that you love learning from our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. So please consult your healthcare provider for your specific care. And to learn more about us and about the podcast, please follow us on Instagram at The Birth Squad. And also check out our website, thebirthsquad.com.
Please keep in mind that some of our episodes may cover topics that could be triggering to some individuals. Listener discretion is advised.
Meet Dr. Griselda Reyes. She's the next badass birth warrior who will share her story to help the squad navigate through the complex and inspiring journey of pregnancy, labor, birth, and motherhood. In this episode, we are talking about her experience with twins. During the interview, you may notice some medical terms or jargon, but don't worry, we got you. We have included definitions and explanations in the episode description. So please listen up and enjoy her story.
Well, welcome back to the Birth Squad. We are super excited today. Ijama and I have a very good friend that is joining us that we've known for many, many, many years. She's seen us through thick and thin, right? When we were stories that we probably can't share.
Mm-hmm.
Yes.
Yeah.
But we're so happy to have her, Dr. Griselda Reyes. We would love for you to start by introducing yourself and then sharing a little bit about your background.
Sure thing. Well, it is an honor and privilege to know both of you and to have walked through some rough patches and be on the other side of it for the most part. I just wanted to start out by saying that I love you both. And I'm super proud to call you friends and fellow colleagues. I'm not going to tear up yet. Okay. My background is that I am a daughter of immigrant parents from Mexico and El Salvador. I grew up with my mom and my younger brother. So she was a single parent in San Francisco proper, in the city, very inner city, mostly the Mission District. And then I went to public schools, went to UC Berkeley for undergrad. That's where I met y'all. And then didn't know if I wanted to do medical school, took a little break, decided to go for it, went to medical school at UCSF, and then decided to do OBGYN residency, and I matched at UCI, which I loved. I then graduated, spent some time at Long Beach Memorial, another hospital that I care deeply about, and now I'm back at UCI working as a hospitalist. So obstetrician hospitalist with a little bit of GYN surgery. I live in Orange County and I have 2 twin boys and a wonderful husband. Yeah, just trying to help, the next generation of OBGYNs and help mamas, through this journey.
Yes. Do you mind telling us about your path to motherhood?
I honestly didn't think I wanted kids until after 25, maybe when I was 28. So I took care of enough, nieces and nephews and cousins and stuff like that growing up that I was like, I'm fulfilled. I have enough, but I decided that I did want my own kids when I was about 28. But that was in the middle of medical school and I knew that I could not handle that. And to everyone that is able to handle that journey, my respects, because it is tough. We decided to wait until the second half of residency. So a 4-year residency, second half. And we were very fortunate to not have to struggle too much to get pregnant. So we got pregnant and I was convinced that, it was going to be easy, but then we found out we were having twins.
Can you tell us a little bit more about that? Like, what was your experience discovering you were having twins? How did you initially feel? What concerns and fears were going through your mind?
I wanted to wait to get seen until about 9 weeks because, as physicians, unfortunately, we see the awesome side of this field, but we also see patients who come in with miscarriages, and I just didn't want to go in to get bad news. So I think that kept me from getting seen as early as possible. So I made an appointment to get seen, and I was about 9 weeks at the time. And all I knew was that since the day that I missed my period, I was super sick. I was extremely nauseous. And I said, oh my gosh, I'm just such a wimp. Like, if all my patients have to go through this severe nausea, severe vomiting, I can't even hang. We got in to see the doctor. And so we get there, we get an ultrasound. This is a transvaginal ultrasound. And the doctor says, wait a minute, I see a second heartbeat. And the first thing I said is, oh no. And then the next thing she said is that I can't really see a membrane, which meant that potentially these were going to be twins that shared not only the placenta, but the same sac. And so I immediately stood up while still having the ultrasound being done. And I was determined to find the membrane. And we found the membrane, and that was great news. But we were both in shock. We were not prepared. Neither one of us, even though there's twins on both sides of our family, we were not prepared. Yeah.
So you were kind of going through the reason why you wanted to make sure there was a membrane. Why was that so important?
So when you have twins that share both a placenta and a sac, there's nothing separating them, which means that their umbilical cords could possibly become entangled at some point during the pregnancy, which can lead to losing one or both, or having constriction of one of the umbilical cords, which can lead to lots of problems, lots of different kinds of problems that I don't want to scare people out. And I was in my 4th year of training, so I think all of those things were quite fresh. I was seeing patients that had those types of pregnancies that were admitted to the hospital for weeks on end, and I just did not want to be one of those people. I wanted the least complicated pregnancy possible.
So, but actually you had twins, surprise, right? So I know you wanted the
Right.
least complicated pregnancy possible, but inherently just by having twins, you were classified as high risk. Was there anything else specific about your pregnancy, that made it high risk?
Yes. I got super lucky with monochorionic, diamniotic twins, which is what I had. So the one placenta, 2 sacs. You still have a risk of a couple of things. One of them being twin-to-twin transfusion syndrome, which required us to get a lot of extra ultrasounds. And we were so lucky that none of that happened, not even preterm labor. I did develop preeclampsia. I got diagnosed around 35 weeks, but it was not the severe kind. So I had to stop working at that point and stayed at home for about the last 2 weeks and got to deliver. Went in for an induction at 36 weeks and 6 days, and then we delivered right at 37 weeks via C-section, which was also not planned. We were trying to have the twins naturally.
Now, I know everyone gets excited about twins, but they can be very complicated.
This is exactly why Dr. Reyes was so nervous. So, Kamisha, can you explain again the different types of twins that exist?
So, first of all spontaneous twins are rare. They account for 3% of live births and 97% of multiple births in the US. In simple terms, there are 3 types of twins: dichorionic, diamniotic, or di-di, also known as fraternal twins. This is when everything is separate. So, different egg, different amniotic sac, and placenta. This is how you get twins of different genders. The next category is monochorionic diamniotic. This is where they share the placenta but have different sacs. However, they have the same egg. So this is an example of identical twins. This is why we see a thick membrane that separates them also. It's their separate sacs. And this is what Dr. Reyes was mentioning before in her story. The last category is monochorionic monoamniotic. This is where everything is shared: egg, placenta, and sac.
So, in addition to being rare, twin pregnancies are also complicated. Risks associated with multiple gestation or twin pregnancy include preterm birth, gestational diabetes, high blood pressure or preeclampsia, anemia, growth restriction or small babies, C section, and postpartum hemorrhage, just to name a few.
Given all these risks, it's easy to see how twins would require closer monitoring. Let's hear what Griselda has to say about her prenatal care and how her delivery looked. We understand that this information may be triggering to some. Listener discretion is advised. I mean, you talked about a few of these things, needing extra ultrasounds, needing to be off of work for a couple weeks. How did who's a part of your healthcare team when you have twins? How did they manage your pregnancy? Can you just kind of walk someone who might not know what that looks like through that a little bit?
Immediately after we found out that there was two embryos in there, I no longer could see the same doctor that I started out with. I had to get transferred to a perinatologist or a maternal fetal medicine specialist. Luckily, because I got to train with them, I got to be with an MFM is the abbreviation that we use that I really trust. And I got to see him. So he became my primary obstetrician at that point. And then he worked with a nurse practitioner who would see me in between. So maybe around every 3 weeks or so. And then I would have ultrasounds around every 2 weeks. In addition, several other patients that were in similar shoes as I was, I got to meet a few. And, they had as part of their team a doula. I did not have my own doula, but I think in hindsight, it could have been really useful, especially in the early postpartum period. So that's something that if there are moms out there that are pregnant with twins, I would highly consider either a postpartum doula or a night nurse, just to help you get through those first couple weeks.
You talked about your delivery, right? You had an induction at 36 and 6. Babies were delivered at 37. So it sounds like, it was an unexpected mode of delivery. So can you tell us a little bit about the circumstances surrounding the delivery and like what did you experience leading up to it?
I have to say that I love the hospital that I delivered at, because the nurses are used to taking care of patients that are quite sick. And that just made me feel comfortable because I knew that even if I was going to deliver by C-section, I was going to be, I felt like I was going to be okay. And I also wanted to try to have the twins naturally because I've had the fortune of being able to deliver twins naturally. I wanted to avoid major abdominal surgery if possible, but we we got as far as about 7 centimeters, and then I just stopped dilating. We really stretched it. We really tried, but at that point, twin A, he was not loving being in the labor process anymore, and then we had a bradycardia that led us to have to rush to the OR. But luckily, I was in a room that was close to the OR. My nurses and my team helped keep me calm, and obviously it does help that we do this every day. So I just try to stay as calm as I could, but it was nerve-wracking, like being on the other side of the drape. I was hoping that by the time we got from the labor room to the operating room, the heart rate would come back up, which is what sometimes happens, and we're able to help patients avoid a C-section that way. But we put the baby back on the monitor. Baby was still down in the 70s. So 70 beats per minute is too low. Another thing that happened is that unfortunately my epidural was not taking to the level that it needed to for the C-section that needed to happen immediately. So I was given ketamine, and so I was C-sectioned, and I wasn't asleep, but I didn't remember, most of the surgery, because it's a dissociative drug, and you go to another place, in a sense, and so I trusted the team and I knew that they, had to do what they had to do. And we thought that might be a possibility, but, until you go through it, you don't really, really understand what it's going to be like. I think really important is to trust the team that you're with and ask the questions that you have beforehand, like what would happen if this happened, or what would happen if we went to C-section, or if the epidural didn't work, so that way, at least before anything happens, you're a little bit more comfortable knowing what could happen. And I think being an OBGYN helped me stay calm. And then we had the babies, and luckily, after that, things went pretty smoothly for them. They didn't have to spend any time in the NICU. They didn't have to, stay to get any extra treatment. I developed severe preeclampsia afterward, and so I had to get extra treatment for that. And that was crummy, but I'd say about day two, things started to feel better. But I do wish that we had had an extra person.
Wow. I really want to thank Dr. Reyes for sharing her birth story. At this point, many of you may have questions about what happened. So we're about to break it down for you.
So, the first question you may be wondering is, do I need to have a C section if I have twins?
Dr. Reyes is a great example of someone who attempted to have a vaginal delivery. We tell most patients that the situations that require C section for a single baby are the same for twins, such as labor isn't progressing, or the baby doesn't tolerate labor, or there's an issue with the placenta or umbilical cord and covering the cervix, or if the baby's head is not down.
For twins, it really depends on the presenting twin, referred to in a lot of situations as baby A, and the type of twins.
Mono twins, or the twins that share everything, have a high risk of getting tangled in each other's umbilical cords. So they will need early monitoring and delivery. Additionally, they are delivered via C section to address those risks.
For the other types of twins, we're going to try to get them to full term. So that's 37 weeks or later. And as we said, if they don't have any contraindications, we will attempt vaginal delivery.
But keep in mind that only twin A needs to be head down. Some providers will turn the second baby after baby A is delivered, or deliver the second baby breech.
Please make sure you're with a provider who feels comfortable managing twins. Now let's hear Griselda's reflection on her birth and postpartum period. So when you look back on your experience, how do you feel about like what emotions kind of come up when you think about the birth and the postpartum period? What goes through your mind?
Yeah, I think, I should say also that my husband is also a physician, which was really helpful because I can't imagine having to explain to a partner that is not, medically trained, or at least even just familiar with the medical field, all that went on. And even as a physician, we had to talk about like what happened and sort of do a replay. And he had to tell me, this is what happened. The baby came out crying, and I'm sad that I missed that. But at the same time, I'm happy that the team did what they had to do to get them out as quickly as possible. Because the trade off would have been, okay, maybe they didn't put me on ketamine, and maybe they would have waited for the epidural to be at a level that it needed to be, and then I could have been conscious for their first cry or whatever. But I knew that I didn't want to compromise their health for that. And so he was able to tell me, part of me will always miss that. But I'm happy that the team got them out as quickly as they did, and that they had no time in the NICU. They didn't have to spend any extra time in the hospital. I think that it is a shock to the body that you don't recognize because you're kind of in survival mode. You're just focused on like, I have to start breastfeeding. I have to figure them out as babies. I have to update our family, so you go kind of into mama mode immediately. And that was hard because you kind of set all your emotions aside, or at least I did, to just start, being a mom.
So obviously, because of your training as an OBGYN, you had prior knowledge about having a twin pregnancy, delivering twins. But is there anything, now that you've experienced it yourself personally, is there anything you wish you had known beforehand?
Oh my God, how hard breastfeeding is. You know, some people have an easy time breastfeeding. A lot of us don't. A lot of us don't. It was a real big challenge for me. And just talking with moms who were in the same boat as I was at the time, just seeing what profound effect it can have on your mental health, on your mood, on your energy levels, on your confidence as a mom, on all of that. I think that one thing we can do better for our sisters and just anyone that's going through that is make sure that they're feeling supported if they're struggling with breastfeeding, because it it's a full-time job. It truly is a full-time job. I feel like we do get some pressure to breastfeed as a society now, at least not when we were babies. My mom was encouraged to give formula when I was a baby. So that's different. And I think it's okay to stop breastfeeding when it's not helping your mental health. And that was another thing I really do have to thank my husband for, is that he was brave enough to be like, hey, it's okay if you want to stop. Because again, when you're breastfeeding, when you're going through it, all you want is to provide for your babies and to give them the breast milk. As much breast milk as you can, right? And so I always had to supplement because I never made enough for both of their appetites.
Having twins is a big deal. You know, everybody glorifies it like, oh my God, I have twins. I want twins. But like, talk about that. Like, what are some of the challenges that you faced having twins?
I think some people are just really great with kids. They understand kids, they speak baby. And I had the fortune of coming across, a couple of wonderful nannies who really spoke baby and were a godsend. But when it's just you and your twins and you're by yourself, which again, I had a lot of support. When it was just me and the twins and they're both crying at the same time and they both need the same thing at the same time, and you have to choose who is going to get your attention first. That is something I don't think I was ready for. And it still happens, but now I'm more comfortable knowing that, you know what, like they're safe, they're loved, they're not alone, and I'm going to get to them in a second. But when you're in that situation, they're both crying, they harmonize, and the cry gets even louder, and you're tired, and you want to cry. That is quite stressful. It's something that moms that have babies that are twins or multiples or very close in age get a lot. You have to find a way to unwind from that, because your anxiety level goes up, and it can stay up there. You don't even recognize it because now you're doing laundry, or now you're washing pump parts, or just managing. The other aspect I would say is hard is like, are they each getting enough attention? Am I giving them each the individual attention that they need to develop appropriately? And that I still have that question sometimes, but I think finding good support is super important. And if you're not good at that already, then welcome to the club. But you really have to try. I hope that you would try to start getting your support system in place. If you're pregnant with twins now, start trying to find some support. There's twins clubs, like twin mom clubs too, that you can join. I just felt kind of overwhelmed, and I was like, I can't join another thing. I can't have another commitment. But I really wish I would have tried it, to see if there were other twin moms that could help or had the bandwidth to help. On the flip side, it's amazing to witness their bond, and it's something that they share that relationship with one another and nobody else does. So that's really nice to be able to see them do their twin talk and not have any idea what they're saying, but they'll always be bonded that way. So I would say, if I could go back, would I choose twins again? Yes, I would. But I would also get a lot more support people to help me. And I think people like us tend to just want to just do it on our own, or we are particular, and we have specific ways we want things done. But I think letting go and recognizing that it may not be done exactly the way you want it to be done, but you also need to rest and take care of yourself so that you can be a caretaker.
Yeah, absolutely. I feel like you answered my next question was like, is there any advice that you would give to someone who is anticipating having a twin pregnancy? And sometimes twin pregnancies do end up as a preterm delivery. Um, so, any advice
Yes.
other than what you've already offered, which has been great?
I would say, especially if you're going to give birth preterm, and you anticipate having a NICU stay, asking your NICU if they have other parents that, can come talk to you that are there, that have been there for a little bit longer to help you sort of navigate that, because I've had patients and I've also had friends and colleagues that have ended up spending time in the NICU, and it's really rough. You can't really sleep very well. Sometimes there's not a place for you to sleep, so you have to sit there as a mom, as a new mom. All you want to do is be by your baby's side. So that can be really rough on your mental health. Having to be out of work for longer than anticipated can be really rough. So there's a lot more challenges. Having good communication with your family and recognizing that you're not going to know what you're not going to know. You have to have, I would say, a lot of grace. Give a lot of grace to your family and to yourself that you need help, and you may not even know what kind of help you need, but there are always social workers there, and other families that you should be talking to. Also, with the breastfeeding, there are lactation consultants that work at the hospital and that should be coming by to check on you and see how it's going. And if you don't feel super confident, there are other programs that are available, either paid or through the government, that you can access to get help. So I ended up doing, like, for the first 3 weeks of their life, I would go in like twice a week. It was an in-person lactation visit where they would literally help them latch, and I would take one twin one day and the other twin the next day. But it was really helpful because these are often people who have gone through it with many families. One thing I didn't do is that I wish I would have done was to, a couple of weeks in, just do one thing for myself, like one thing that is not related to being a mom or being a doctor or whatever profession you're in, that is just you, so that you don't lose yourself, because postpartum depression and anxiety are real, and you need to find some way to just relax, as much as you can. And you're not going to want to. You're going to want to just be at your baby's side. You're going to want to be a mom like 100% of the time, sometimes. But you should also try to do something that's not related to anything except for just you. Even if it's like for an hour a week, if you know, I would say that. So we ended up having a night nurse or a night nanny come when they were about 4 months old, because that was like peak sleep deprivation for me. They weren't night trained, or like they weren't sleep trained yet at that point, and 4 months of sleep deprivation plus finishing residency and taking boards and all that, it just all accumulated. And so again, my husband like knows me, and we agreed that, it was going to be good for everyone, for someone to come in so that I didn't have to wake up at night to feed them, and I could just get a solid 6 hour sleep. For those that are not used to sleep deprivation, I think with twins it's a little bit harder. So I would also recommend putting the twins on a schedule. And it's not gonna be cute or fun to have to wake up one of the twins to feed them when they look so peaceful and angelic just sleeping there. You're like, why would I wake them up? But if you don't put them on a schedule whereby you're feeding them at the same time or like back to back, you're never going to get sleep. Sleep's going to be really hard. And I'm really happy that we did that. And I'm also happy that we sleep train them. We sleep train them at around 5 months, and it's not for everyone. And, you know, I, we tried the just the cry it out method, and that was really hard because I would have to physically leave, and my husband had to do it, because I couldn't handle the crying. And but they did it, and they're fine. I don't think that they're psychologically scarred from it. But that's not for everyone, and I can totally understand how it, like, if someone doesn't have the support that they need to do that, that why they wouldn't do it. If I was by myself with the twins, I probably wouldn't have done it. But it did really well for both of our mental health that we could get them to sleep through the night.
Good advice.
So helpful.
Yeah.
Griselda shines a light on a difficult period, postpartum, which is now referred to as the fourth trimester.
Oftentimes, people think that delivering the baby is the hard part. But unfortunately, we see a lot of couples who will really struggle during the postpartum period for many reasons.
Dr. Reyes shared some of those reasons, which include breastfeeding struggles, sleep deprivation, healing from delivery, and just adjusting to having a newborn.
If you can, we really encourage you to try to ask for assistance. This includes talking to your birth provider to figure out what resources are available to you.
Now let's hear what information Dr. Reyes wants to leave us with.
If you had to think about someone who had a C-section, what advice would you have about that? Like, have you thought about, is this it? Or are you guys going to have more? And if you are thinking more, would you do another C-section or would you try to have a vaginal delivery?
We haven't decided yes or no. I think on some days it's maybe, other days it's absolutely not. And other days it's like, oh, that would be so nice. So I don't think that the door's completely shut, but I'm super happy with that, with what I have, this beautiful family that I've been blessed with. So if it just stopped there, I would be perfectly fine with that. That's one other thing I missed. So if you end up having a C-section, whether or not had just one baby or two or three or however many, it is major abdominal surgery. And I tell that to my patients all the time. And I kind of just stop in my tracks to make sure that they know this is a big deal. Yes, it is the most common surgery. However, it is a big deal. And I think when you're a first time mom, you don't care. You care about your baby and you want to be getting up and you want to be feeding them and just being the mom that you thought you would be. And you are recovering from major surgery. So what I tell my moms that I didn't do, and I ended up actually having an infection at my wound site or at my incision, because I ignored my own advice. I just, after a couple of days, I was like, oh, it's fine. And I ignored it. I would say that as a new mom, if you have the support, all you should be doing is sleeping, eating, feeding the baby, cuddling your baby, and taking a shower when you feel like it. And that's about it. Everyone else can help with the diapers, help with meals, help clean the house, help do bills, and all of that other stuff. And I had the support, but I felt compelled to be the one to get up, to change diapers, and, do a lot more extra stuff than I should have. I should have just sat down. um, and so maybe if you're like me and that's your kind of style, like you can't sit still, just maybe take it down a couple notches. Maybe do 50% of what you would originally want to do and be okay with the fact that no, you're not going to be able to do all the things you want to do. But it's for a limited time and no one's going to judge you, and you need to recuperate from major surgery so that you can do all the things you want to do. Take care of your incision, make sure it's nice and dry, clean and dry. Moist environments and dark environments breed infection. So you want to air your incision if you need to, if you have the belly hang or belly overhang. So if we had another pregnancy and whether or not I would want a repeat C-section versus trying vaginal, I would try to have, and the baby's head was down and everything, I would definitely try to have vaginal delivery because the recovery is just, obviously I see it every day. I know that it's possible as long as you do it in a hospital that supports and is equipped to handle a TOLAC or a trial of labor after C-section. That I definitely would recommend. Now, if I knew for a fact that I wanted to have my tubes tied and, and I don't necessarily want to. Everyone's different. If you do, then I would maybe consider having a repeat C-section and a bilateral tubal ligation at the time of that surgery, just because it would save me a surgery. Had a lot of patients, have successful, have VBACs or have vaginal births after C-section. It would be really nice to have that recuperation rather than another C-section, because I don't know what scar tissue is present there. I don't know how complicated my repeat C-section would be.
Is there anything else that you want to share with the Birth Squad?
Yes, y'all are doing an amazing work. And I hope that your listeners know how thoughtful and intentional you are. I hope that you continue to highlight that people are experts of their own stories and their own bodies. That's really refreshing, because it's so needed. We do need to remind people that they have the control. They have inside of them all that they need, in so many ways. Just keep having that same spirit. And same for moms out there, and same for people that want to get pregnant or have families. Like, you just need a little bit of support, and don't do it alone. You can do it alone, but it's really hard. It's really, really hard to do it alone. So don't do it alone. Don't be afraid to ask questions. Try to enjoy it. That was one other thing that I wish I would have enjoyed my pregnancy a little bit more, but I was so kind of stressed about what could happen. So even if you do like a maternity photo shoot on your iPhone or on your own phone, look it up on YouTube. It's very easy to do. If you're too busy to have like a full on, ocean side photo shoot, if that's not going to work, just do something small to enjoy it. Enjoy, even if it's hard, even if it's a really complicated pregnancy. Like, there are positive and joyful aspects in the struggle. But I hope it's helpful. And if anyone has questions, I'm happy to be reached by email, especially for moms out there pregnant with twins. The timeline to get back to you would be like a week or two, because my boys are still small, but I will definitely get back to you.
We will definitely include that in the show notes. Thank you so much, Griselda. You're amazing. Like,
You
just,
guys are amazing too.
you're sharing your experiences and the work that you're doing as an OBGYN too. You're really making an impact and a difference, just by virtue of who you are and where you came from, So I love that.
Thank you for saying that. Thank you for having me. I just am so excited for y'all. I can't wait to see what happens in the next few years, and yeah, and I love that these platforms exist and that people can have a little bit more information going in. So I applaud your work. Please keep doing it.
That's the wrap of this episode of The Birth Squad.
Thank you so much for joining us this week. We are going to continue sharing stories from more badass birth warriors, because at the end of the day, you are the experts of your experience, and we want to highlight you and your bold, brave, and beautiful journey to motherhood.
And we want to hear from you. Tell us about what topics you'd like to hear more about. Hit us up on Instagram at The Birth Squad, and check out our website, thebirthsquad.com.
Most importantly, be sure to share this episode with your squad.
Until next time, I'm Dr. Ijama Okwandu.
And I'm Dr. Kamisha Thomas.
Peace, love, and solidarity from the Birth Squad.